Welcome back to our part 2 of our lecture on renal and vascular pharmacology. In this particular segment, we are going to look at antihypertensive medications, that is, medications used to treat the condition of high blood pressure. Objectives for this unit include, you should be able to list the 5 classes of antihypertensives and give 2 important adverse effects for each class of antihypertensive medications. The 5 classifications of medications that we use to treat hypertension are diuretics, beta blockers, calcium channel blockers, ACE inhibitors, and angiotensin receptor blockers, otherwise known as ARBs. Now, I know, it looks like a lot, but if you think about it, we've already covered 3 of the 5. Beta blockers, which prevent contraction of blood vessels by interfering with the norepinephrine stimulus, and calcium channel blockers that relax smooth muscles by blocking calcium from coming in to a cell, preventing it from contracting and therefore preventing the blood vessels from constricting. We talked about when we talked about medications for the heart. So those you should already be familiar with. Diuretics, we just talked about in the previous section in renal and vascular pharmacology. So that leaves us with 2. And the last 2, ACE inhibitors and angiotensin receptor blockers. So ACE inhibitors, that term ACE, ACE is actually an acronym, angiotensin converting enzyme inhibitors. And this, along with our ARBs, are probably the 2 most important classes of drugs and the 2 most frequently prescribed medications for treatment of hypertension. What happens with these is, if you recall way back when to anatomy and physiology, there is a series of enzymatic reactions that happens that converts angiotensin to angiotensin II, which then binds with the cells in the blood vessels and causes them to constrict. So if we don't want the vessels to constrict, we can somehow arrest that process. And that's what ACE inhibitors do. What they do is they prevent angiotensin I converting to angiotensin II. As a result, the blood vessels dilate instead of constricting, and you end up with vasodilation in both arteries and veins of the body. When the vessels are bigger, there's less pressure, and the blood pressure drops. So angiotensin converting enzyme inhibitors, ACE inhibitors, block or arrest, is probably a better way of putting it, arrest the formation of angiotensin II and therefore decrease the ability of the blood vessels to constrict. Now if we take a look and contrast that with our second new class of medications here, angiotensin receptor blockers, ARBs. And what they do, instead of arresting that chain of events from happening, they actually go in there and put a block. They interfere with the receptor sites. So as a result, they bind with the receptor site of a cell, and angiotensin II cannot bind with the receptor site of the cell. Therefore, the angiotensin II is not binding, so the vessels are not contracting. Again, similar to ACE inhibitors, produces vasodilation, dilation of the blood vessels. If the blood vessels are wider, there is less pressure in them. It'll also has an effect of causing a slight increase in the excretion of sodium and water also, which further helps bring blood pressure down. So it's a pretty potent medication as far as lowering blood pressure. Example of an angiotensin II receptor, you had one on your drug list, and that was Cozar. And the second one that's very popular and being used, prescribed a lot too, is Diovan. Now, the one thing we need to talk about, though, is those side effects that are common to these medications. Both anything that's going to decrease of blood pressure gives you a risk of something called orthostatic hypotension. And orthostatic hypotension is that low blood pressure that occurs with change of position. Now, normally you stand up, and when you stand up, your blood vessels constrict so that blood goes up to your brain and not down to your toes, okay, if you were lying down or you were sitting. Someone who is on a medication that is decreasing their blood pressure, particularly the ARBs or the ACE inhibitors, has the decreased ability to be able to contract those blood vessels. So if they are sitting or they are lying down and they suddenly stand up, their body cannot compensate for their change in position by contracting their blood vessels. As a result, they don't get enough blood to their brain, and they get dizzy and they get lightheaded. That's the most common side effect we hear with patients on these medications. So it behooves you, if you do have a patient who is on these medications or just new to be put on these medications, one of the first things you do is warn them they may need to stand up more slowly from a lying or a sitting position to allow their body to gradually adjust blood flow to their brain. In addition, we may see some nausea and headache going along with these, again, just due to the change in the blood flow to the brain. So they are also common side effects that we may see with these. So let's kind of just take a look at a case study here and think through this a little bit. Mrs. Crash is brought into the emergency room after passing out. She is sweating profusely and has a pounding headache. Her blood pressure is 215 millimeters of mercury over 125 millimeters of mercury. Sounds a little off, doesn't it? So, what's your diagnosis? I'm hoping you were immediately screaming high blood pressure at that point, and in fact probably acute hypertensive crisis if you wanted to be more specific. So the 5 classes of medications she should be given would be what? Okay, let's see if you got them all. She could be given a diuretic. She could be given a beta blocker. She could be given calcium channel blockers. She could be given an ACE inhibitor or an ARB, an angiotensin receptor blocker. Or she could be given a combination of any of those medications too. So we'll say, one of those medications was picked. My guess it was going to be either an ACE inhibitor or an angiotensin receptor blocker. With that high of a blood pressure, we're going to want to pull that blood pressure down pretty quick. So what side effects would you want to warn her that she could experience once her medication therapy has begun? Okay, so I hope what you're thinking in there is that, the big one, orthostatic hypertension, you're going to want to warn her about that. Headache, dizziness, some nausea would be really common ones. And again, you can assure her that most times they will subside after her body adjusts to the medications. But if she is experiencing any of those things, she can feel free to call the office so that you can keep an eye on her and monitor to see if a dosage adjustment does need to occur. And with that, we end our information on antihypertensives.